All right, welcome to the Snide Report podcast. See, I almost forgot what I was going to say there. But anyway, welcome to the Snide Report podcast. I am your host, Gary Snyder. And before we get to our next guest, which you can probably figure out who that is by now, just from the camera, we need to thank our sponsors, Robin Winston. Robin has been with us from the start, both on the newsletter and the podcast. Our newsletter now goes out to over 100,000 subscribers daily across the state. And also, we cannot forget about our great sponsor of both the newsletter and now the podcast, former Congresswoman Jill Long Thompson, and her new book, Across the Aisle, Why Bipartisanship Works for America, is out. You can get that anywhere you buy your books. And don't forget, there's a subscribe button down below. Just hit it. That way you stay in touch and get all the updates whenever we launch a new podcast. My guest today is State Representative Maureen Bauer. Maureen, welcome.
Thank you.
And, you know, I'd be remiss if I didn't thank you for all of your past support for the newsletter. So thank you. Much appreciated.
Pleasure.
Now, we wanted to
Absolutely.
bring you
Thank you
on
for
today
having me and for
because,
connecting people.
well, thank you. We wanted to bring you on today simply because you showed up in an article in the Indianapolis Star, and you have been at the forefront of this when it comes to health and healthcare in Indiana. Yesterday, Governor Braun had RFK Jr. and Dr. Oz in. And I can't help but think that picture of them all standing up there, that's what a measles epidemic looked like if it were a picture. So as they are doing the Make Indiana Healthy Again, when you look at RFK Jr. and Oz and what the General Assembly and what Mike Pence, boy, I am in the wrong governor here, Mike Braun are doing to Indiana's healthcare. And where do you fall on this? Because to me, it just seemed like a joke.
Well, it was a political stunt. I mean, you're bringing in Dr. Oz and RFK, whose past theories in regards to health are questionable at best. I mean, there's a lot of fear-mongering behind their rhetoric. They are clearly, with the name Make America Healthy Again, using a partisan slogan. And absolutely, let's make Indiana healthy. It's always been the goal. You can see plenty of pieces of legislation that have been introduced to support some of these initiatives that were in these executive orders, but it's certainly not a partisan issue. And to bring in, these DC folks that have
You can call them quacks if you want.
I mean, they're controversial. They believe in pseudoscience, and we should have some health professionals that are trusted not just by one party, but it goes beyond party lines when we're talking about health.
To me, it's very ironic, almost dripping with irony, that when they are up there trying to say, make Indiana healthy again, they are in the process of cutting Medicaid, which, over 10% of Indiana's healthcare. 41% of all births are Medicaid in Indiana. Over 70% of seniors are on Medicaid in Indiana. We have wait lists now. We're cutting people from the rolls of Medicaid, requiring work requirements that weren't there before, which, quite frankly, are going to cause people to lose their health care in Indiana. So to me, it seems a little ironic that they would come here and try to push that when they are actually making things worse.
Yeah, I mean, there's about 2 million Hoosiers on Medicaid, about 600,000 receive SNAP benefits. So these executive orders put some restrictions in place where you can't use your SNAP benefits for soda or candy. Well, I mean, let's move candy from the checkout aisle. They want to get at the root cause of these health problems. And unfortunately, you can't legislate your way out of a lot of these things. We've been told that time and time again on other issues. To convince people to choose healthier lifestyles does come from funding those resources. If you want people to walk 20 miles a day or 20 minutes a day, like Dr. Oz said, give them safe walking paths, safe trails, invest in our parks and trails at the state level. Let's make sure that we are protecting vulnerable road users like pedestrians and bicyclists, making sure that our roads are safer. We have pedestrian fatalities across the state, and we've been trying to introduce legislation to address that and make safer roads and trails. There have been plenty of opportunities to invest in the health of Hoosiers, and that largely is connecting them with healthcare services, preventative healthcare services. And by implementing work requirements, which ironically they're beyond this executive order, there's also a bill, Senate Bill 2, going through right now that does mandate a work/volunteer requirement. We on the health committee took into consideration lots of public testimony. We have exempted pregnant individuals. We've had exempted full-time students. We've exempted individuals caring for someone who is severely ill or disabled or caring for a young person. And not everyone can work or volunteer 20 hours per week. But I want to say the myth that people aren't working on Medicaid is not true. Majority of them are working. And a lot of this attack on individuals on Medicaid is not getting at the root cause of the fraud, which is a serious concern. Yeah, let's go after fraud in Medicaid. But the major cost of Medicaid is not fraud, it's the administrative costs. And with these executive orders, we're putting in more administrative costs. When you have to renew your eligibility 4 times a year instead of once a year. If you don't have the presumption from the hospitals when you go seek into care, that's just gonna cost the state more in the end. So yeah, the slogan sounds good, but we're not getting to the root of the problem, to be real here.
And it's I hate to keep using the word irony, but I mean, to bring RFK in and his anti-vax past, when we now have an outbreak of measles, not only in Texas, but now over 5 cases in Indiana.
Yeah, and all 5 of those were unvaccinated. The difference between this administration and the Holcomb administration is already proven to be quite vast. I mean, the Healthy Indiana Families, which gave millions of dollars to local health departments to fund whatever programs they deem necessary. They take surveys of the area, they decide what issues are important to them. It could be expanding vaccinations for children, it could be providing nutritious foods, it could be addressing our infant and maternal mortality rates, it could be smoking cessation. Every 92 county across the state opted into that funding. And in the Braun budget proposal, he cut that funding. And so if we're going to, again, invest in the health of our residents, it costs money. It costs programs to ensure that we have that healthcare access, that we have tried to increase the cigarette tax for decades in the state. And it's proven that if you do that, it will create healthier community. So I think some of these ideas are democratic values and is happy to see them jumping on board. I think California and New York are the 2 states that have banned some food additives. And if we're going to be the next one, absolutely, let's do it.
You brought up Governor Holcomb, and I would agree with you, and excuse my language, at least he appeared like he gave a rat's ass. Braun and this current administration of MAGA wannabes does not even seem to care.
Yeah, it's shocking to me because Braun's path it started in the state legislature. He worked in this chamber like we are. And he signed, I think, a record of executive orders yesterday. And it's also that executive order is just following the path of the Trump administration. These flurry of EOs and everyone trying to keep up and read what's in them and understand the impacts of these. So I think, he ran on the fact that he's not a politician. I think he's proving otherwise by the people he's bringing to the state and who he's following to be his mentor, which appears to be Donald Trump.
When at the press conference yesterday, one thing that I did not recall hearing about, maybe it was when I wasn't paying attention, and that was a lot of it. But, Indiana right now has some of the highest maternal and infant mortality rates in the country, even rivaling some third world nations. And then you take a look at what they're doing for women's health care or for children, even to the point now of getting rid of caseloads for DCS. It doesn't seem to me like healthy children and healthy mothers is a top priority for them.
Yeah, I mean, we've been talking about this statistic over and over again. We continue to study it. I mean, expanding access to care is key. Prenatal care, helping prevent unintended pregnancies is key. I think a lot of this executive order kind of oversimplified a lot of the major issues that are really facing Hoosiers and the real concerns about our health and how serious we should be taking our public health instead of politicizing it. We continue to push for healthier moms and babies to be, flip the script on being pro-life is like, let's invest in their health care. And so, yeah, it's shocking that you wouldn't address that when you're talking about health. Also, as you mentioned in the opening, how many births are on Medicaid? And then we have the priority of cutting enrollees on our Medicaid program. HIP was designed under Republican administration, and we need to invest in that program. We should want to have the best health care in the country and invest in the health of our people by improving their access to care, bringing down costs, in the hospitals or primary care or prescription drugs. I mean, that is the barrier to accessing care. Either you don't have a hospital in your community, which, over 33 counties in the state don't have a hospital, or they do not have a birth center, so making it harder for pregnant women to access care, or it's the cost and you're not willing to choose between a utility bill and that prescription to bring your blood pressure down. It's ironic that a lot of the things they wanted to address in regards to making us sick, we aren't addressing through other contaminants like lead in drinking water. There's been a bill to address that and how severe it impacts a child's development if they're exposed to lead at a young age. Go back to the PFAS debate last year, where we're trying to have a truth in labeling about your exposure to toxic chemicals, and the Republican Party pushed back against that. A more informed public is going to make better informed decisions about their own health. But of course, cost is a major factor. Fresh fruit and vegetables cost more, or we have a number of food deserts across the state. Let's expand access to healthy foods instead of just restricting what you can spend your SNAP benefits on. And I don't know if I said this earlier, but it's a myth that people on state assistance are using it to buy sugary foods. I think it's less than 2% or less than 3% use that funding for sweets. And it is a treat, and kids deserve to have their snacks too. And, I think the myth that we're saying that they're abusing their benefits is just a rhetoric that I don't buy into. I think, quite frankly, is wrong.
You're from northern Indiana. I'm from northeast Indiana. I know a lot of counties that surround Fort Wayne and Allen County have lost maternity care. A lot of rural areas have lost that. Has the legislature or the governor done anything to address that?
Not this governor so far in his first few months, sorry. They have introduced a bill to expand access to midwives, and we've had plenty of legislation to allow more benefits for doulas to direct bill. There's been some study on it, lots of summer studies on the topic, but I do find a reluctance. The Medicaid billing process is so complex, and that would be a great way to streamline, to allow more providers to provide more care. There are a lot of birth centers currently. Years ago, they made birth centers eligible to be reimbursed by Medicaid. That was a major change. I wanted to codify that with a piece of legislation this year. And so we can encourage more people that live in areas that are maternity care deserts to open up birth centers. I think there was a county that reached out to me and their hospital closed, and a lot of those individuals wanted to stay in the area and they wanted to continue serving their neighbors and their community even though the hospital closed. So they wanted to strengthen their ability to create these birth centers, serve their community. And there's, again, a lot of myth that birth centers aren't as safe as hospitals, that midwives aren't as trained as OB. So you learn a bit more about these internal battles within the medical field, but also a lot of midwives are female and a lot of OBs are traditionally male. And so there's, again, a lot of rhetoric that maybe puts down the profession according to traditional gender differences about who is kind of calling the shots. And so we've run into some of those debates in regards to expanding maternal health care. I would say every year I've been in office, we've shifted the needle a little bit to expand access to care. But, some of that was thanks to the Medicaid expansion under the Affordable Care Act. So our maternal mortality rates were so dire that, that was found after birth, up to 1 year after birth, that would be determined maternal mortality. And so my first year in office, we expanded Medicaid coverage up to 1 year post-birth to help capture those individuals to continue seeking out their medical care. And that's eligible under the Affordable Care. So we can see how we can work in tandem with the federal government. A lot of these things that were brought up the other day fall under FDA. I mean, we've had bills to ban high fructose corn syrup or red dyes in our food, but it's very hard for a state to do that on their own. We need some leadership at the federal level. And Europe is miles ahead of us on this issue. There's so many things that are allowed in our food that aren't allowed in the food in Europe. And so if they're willing to look at that, I support that fully. And we can jump on board with, like I said, California and New York.
I was interviewing Minority Leader Shelley Yoder yesterday, and she said one thing that really, I guess, shook me to the bones a little bit. And that has to do with these organizations that come out and tend to be supporting pregnancy and offering pregnancy care. Don't really do that. And that this budget is probably going to still keep giving them a lot of money under the guise of offering prenatal care when they really don't. And I don't know if you watch much TV, but to quote Ted Lasso, he once said, "Don't be judgmental, be curious." Well, I think right now I'm to the point to where I'm being judgmental. Am I too far off there?
No, you're right. I mean, these are called crisis pregnancy centers. We have a lot in northern Indiana. I want to say there's about 90 or two in the state, and they do get state funding. They do not have to provide any medical care. They are providing support services. I had a bill that would require anyone who operates an ultrasound machine to have technical training. Because I've heard stories from my community of someone going into one of these crisis pregnancy centers. People are dressed in scrubs. It looks like a doctor's office. There's a waiting room. You fill out paperwork on a clipboard and you go back, you take a pregnancy test, and they give you an ultrasound, which is just essentially a picture. The person running the machine has no training or isn't required to have training to run that machine. And there was an individual in my community who had ectopic pregnancy, and it should have been identified in that image, and it wasn't. And she lost that baby. And then she had to have a procedure to which ultimately removed her uterus and her ability to have children in the future because it had gone undiagnosed for so long. She had to have this surgery. So that woman should have had the knowledge, should have been given the knowledge to choose where she goes to access her care. So there have been a lot of opportunities where we attempt to make sure that they are providing scientific information, that they are either saying they aren't providing medical diagnoses, that it's a non-diagnostic ultrasound, but women are being misled to think that these are, healthcare centers when they are just providing therapy essentially to talk someone out of having an abortion. I think there's been a lot more attention to the public about these. At least I feel that way. Maybe it's just because I've been on the inside and I know what's happening in our community. But if they play by the same rules, then they can exist. They can help fill in that gap of access to care, but they have to have someone there who's trained to read that machine and will set her up with a prenatal appointment, which they don't do. And so if the state really wants to invest in moms and children, that's one place we can certainly look at, providing a need for them.
Last question for you, because I know you're very busy down there in Indianapolis. But when you see Governor Holcomb standing up there, you see Micah Beckwith, you see RFK Jr., you see Dr. Oz, you see many, I believe there were some U.S. Congress people there, you see the General Assembly there, and they are in charge of our health care in Indiana. Is there any reason to be optimistic?
I'll say, some of these ideas we support, like healthy school lunches, but that comes with money. And you can get up there on a stage at the podium and a beautiful banner and tons of cameras and say you believe in some of these things, but you have to invest in them. You have to tell the USDA that cutting millions of dollars in contracts to food banks and schools to buy directly from local farmers is happening right now and is completely contradictory to what the governor stated he wants to do. So it is literally in one ear and out the other, because we had that set up and it was the Trump administration who canceled those contracts. And will now food's going to waste. You've seen the images around the news. I mean, to support our farmers and keep that food local is huge. And that's something that we have attempted to do at the state legislature, to have some of these high school 4-H programs sell directly to schools. But when you have millions of dollars, I think they cut $1 billion nationally in these USDA contracts between schools, food banks, and local farmers. And then you have our governor saying we need to have healthy school lunches without putting any money behind it. A farm to school program, but it cannot be an unfunded mandate at a press conference. You really have to invest in our children and our future to see a healthy Indiana.
Where can people find you on social media, websites, stalk you in a good way, if that's possible?
I'm everywhere you find your videos. I'm on Facebook, Maureen, think the number 4 Indiana. Same on Instagram. I'm on TikTok, sometimes reluctantly on X. And I try to keep people informed. Now that we're in the last 2 weeks of session, things are moving really fast. So we try to tell you where some of these bills that have taken 4 months to get to passage are and how they've changed. So yeah, please reach out and let me know how we can help keep people informed together.
As we wrap things up here, we need to thank our sponsor, Robin Winston. Has done a great job in helping us jumpstart the newsletter, which now goes out to over 100,000 subscribers daily. Does a great job with the podcast. And also former Congresswoman Jill Long Thompson, her new book, Across the Aisle, Why Bipartisanship Works for America, is out. Get it anywhere that you find your books or buy your books. There's a subscribe button below. In just 1 month, we've taken this to over 200 subscribers and reaching 40,000 views on our podcast. So keep up the good work. Hit the subscribe button. I'm Gary Snyder. She is not. She is Representative Maureen Bauer. This is the Snide Report. More out.